Hi, everyone. It's great to have you here. I'm Teresa Youngkin, and I'm passionate about helping healthcare leaders stay ahead of the game when it comes to new technologies by translating IT concepts into easy to understand business speak. So, whether you're struggling with managing patient data, dealing with resistance to change, or trying to make informed decisions about new technologies, got you covered. Well, in this video, we're going to talk about healthcare data interoperability. We're going all the way back to the beginning. Now, healthcare organizations have always been focused on trying to provide high quality patient care. But as the healthcare ecosystem becomes more complex, they all face a challenge that plagues all these healthcare systems, and that's the lack of data interoperability. First things first, let's come to a common understanding of what healthcare data interoperability is. And to do that, we need to get to a common understanding of the terms that are being tossed around in organizations. Now, this is a critical first step in any initiative that you have, being able to speak the same language. Well, here's a little bit of history about how we arrived at the terminology around health data interoperability. Back in the early 2000s, the prevailing thought was that we needed data in a computerized way to be able to share data. That part is very true. What we didn't know, and what became painfully clear once we started using electronic health records and capturing that data electronically, we couldn't get that data from one healthcare system to another healthcare system. It was not easy to share. And that meant that we were going to have even more challenges around care coordination, and that it was going to be really difficult to really have any effect on patient outcomes. So, organizations had this promise of using these EHRs, but they weren't realizing the promise of digitizing data, and they quickly came to the realization that they needed to continue to evolve the solutions. And that's when they started to discover that missing piece. That's healthcare data interoperability. So, by implementing data interoperability standards and the processes around them, they could ensure that data could be shared securely and efficiently between different systems. So, that's when we started getting into all of these different programs, right? Like promoting interoperability or even meaningful use, and understanding what HIEs were, and having Medicare shared savings programs. All of this started to boil out of this need to have data that could talk to one another. Well, many of these organizations realized that this was the key to better coordination, to improved patient outcomes, and to having a more connected healthcare system overall. And organizations began to learn everything they could about data interoperability, from the latest standards to best practices in data quality and governance. So, this is when we started to see standards like X12 and FHIR come out, right? Things like IHE, integrating the healthcare enterprise. So, these data standards started to kind of trickle out into the market. And there was many years where people were trying to figure out, like, what can I use? What can't I use? And we had many organizations, and many organizations who had like resources, right? And they could innovate and they could do these proof of concepts. And they started advocating for data interoperability within their own organizations. And they were pushing for the adoption of these standards externally from their organizations. They collaborated with other organizations to promote data interoperability across the entire healthcare system. And they were doing joint projects like the uh, the I think it was the Coordinated Care Collaborative, the Triple C, that was between like Geisinger and Inner Systems and Kaiser, to really talk about how do we affect change across the whole community. And these were leaders at that time. So, they start to push out these proof of concepts. And, once they started to get traction, and once the market starts to see everything that happens, these demonstration projects then started to influence when policy levers were being pulled. And when that happens, that's when we know that policies get mandated, right? And that happens not just for a couple, but for the masses. For example, right now, we've just had a whole bunch of new rules over the past couple of years come out, saying that we had to use FHIR to meet the patient access API rule. That's a lot of the reason why, like I talk about it, right? When we have the policy levers pulled, and organizations have to start to use it, that's when we start to see it move from innovation to adoption in the greater market. And when we get to that adoption, that's when we start to see the need for more education and more understanding. And that's when we look back to the organizations who've done these demonstration projects and we start to look to them and see what were the lessons learned. So, some of the lessons learned from this new implementation of these new data standards was that they had to go beyond any of these initiatives just being IT focused and meeting regulations. And they started to work to bring understanding to the broader market, number one, about how health data and operability initiatives can be used across the organizations. But they also talked about how this is not just an IT project, it's a whole organization project, it's a business project. And this is where that collaboration that I talk about a lot comes into play. Then we see great strides in making change happen with organizations like Aledade, and they're seeing significant improvements in patient outcomes and care coordinations. Now, when you're able to start to share data seamlessly with other organizations, this leads to better operational processes, reduced waste in time and resources, and it improves patient member satisfaction. Well, I hope that you've enjoyed like this little overview of what healthcare data interoperability is, that you're able to speak to it if you come from the business side and when you come from the IT side, so that together you have this common understanding of what it is health data interoperability is, how it's going to work within your organization, and how you're going to carry these initiatives forward. And if you're having trouble kind of forming that all together, communicating interdepart intra and in, interdepartmentally in your organizations, I'd love for you to book a call with me today and let's discuss how we're going to start to work towards really creating a plan to help your business, the IT to work together to realize the benefits of healthcare data interoperability within your organization. And you can just click the link to schedule a call at a time that works best for you. So let's start exploring the possibilities together now. Health data interoperability is here to stay. It's not going anywhere. And if you've seen that whole rush of new rules that are just dropping, it is being talked about and it's here. So let's start talking. All right. We'll see you guys here next week where we're going to have another conversation all around Web3 and beyond healthcare, leadership, and technology. All right. We'll see you then. Bye.